time now for our weekly checkup with Dr. Isaac Bogoch as we talk about all things public health and infectious diseases. Dr. Bogoch, good to see you this morning. We've seen some sporadic cases of measles kind of popping up in different parts of the province beyond the sort of core outbreak in southwestern Ontario. Is that kind of to be expected? Were you anticipating we'd be talking about this at some point?
Yeah, unfortunately, we're going to see that. We know that the vast majority of cases are located in southwestern Ontario. You know, again, said with no stigma, no value judgment, but this is typically among an under-vaccinated and a non-vaccinated community, primarily a Mennonite community in southwestern Ontario. But of course, throughout Canada, including throughout parts of Ontario, there's under-vaccinated pockets here and there. People travel. We're living in an era of unprecedented human mobility. This is one of the most transmissible infections on the planet. And when you have sadly, a critical mass of infection in a certain part of the province and people move about, this infection is just more probable to find other unvaccinated or under-vaccinated communities. And you're going to see sporadic cases elsewhere. The whole point here is anyone who's not immune should be up to date on the routine childhood immunizations, because the measles vaccine is free, it's widely available, and it's extraordinarily effective in preventing infection. And we have decades and decades of safety data with this vaccine. Yeah,
we've talked so much about that, and you've shown us the charts on that too, Dr. Bogoch. In the meantime, another situation north of the city in Barrie, where there's an exposure to hepatitis A at a local Tim Hortons up there. What are the signs and symptoms people should be looking for if they think they may have been exposed at that restaurant? And also, how generally protected is most of the population from something like Hep A?
So hepatitis A is a viral infection. It's transmitted, don't get grossed out, but it's transmitted by what's known as the fecal-oral route. So it's shed through the gastrointestinal tract, and it can be transmitted to other people. If people, for example, who are infected with this virus don't have appropriate hand hygiene, or they are touching food or beverages and can contaminate food and beverages, and other people are inadvertently ingest it. It's got a rather long incubation period, at least 2 weeks, sometimes even over a month. And kids tend to not get that sick from this. They might have mild symptoms or no symptoms. Adults, oh man, it's a doozy of an infection. Like, put this on the list of things that you don't want to get. You get massive inflammation of the liver. It can cause fevers, abdominal pain. People may appear jaundiced. There can be nausea, vomiting, and people can get very, very sick from this. It rarely is fatal, but again, you just don't want to get this. And of course, it's totally preventable. People with hepatitis A infection should clearly not be working in the food industry. And the interesting thing is, because of the long incubation period, if someone has an exposure to hepatitis A, they can receive the hepatitis A vaccine after that exposure, usually within a couple of weeks. The sooner the better. And the vaccine will actually prevent people from getting the infection. But the trick is, you have to know you've been exposed and then get the hepatitis A vaccine shortly after that exposure. But it does a remarkable job in preventing infection. And if you have never had an exposure and want to prevent hepatitis A, for example, if you're traveling to areas where there's more hepatitis A, the vaccine, again, also has decades of data. And this is one of those vaccines that lasts for decades and decades, maybe even the entire lifespan of the individual. It's a very effective vaccine. Again, hepatitis A, file under things you don't want to get.
It sounds very much like that. Okay, Dr. Bogoch, we're going to have to leave it there for time today. But listen, appreciate this as always, and we'll talk to you again next week. Have a good one.
Be well.
Thanks so much.
Thank you, Nick.